Hello, everybody. Good morning, good afternoon, good evening. My name is Gifty. I am with NIH. I will be a facilitator today. And I'd like to welcome you to the consulting services session. We will have 3 presenters in this session. Each presenter would have about 5 to 7 minutes to present, and with follow-up about 3 to 5 minutes for questions. So without wasting too much time, I would like to invite our first presenter, Andrew Collier.
Actually, Bianca is presenting.
Oh, okay, I'm sorry. So Bianca, you have the floor.
I don't see Bianca in the room. Is she here already?
I don't see her either. Let me see if I can find her presentation.
I do see Bianca. Bianca, can you say something in the chat maybe if you are unable to speak?
Or perhaps you can
there we go.
switch around. There we go.
You're muted, Bianca.
There you go. All right, can you hear me?
Yes, perfectly.
All right, sorry for that. Just as I joined the breakout room, my Zoom decided to quit completely. All right, can I start sharing my screen?
Yes,
you
go
may.
ahead. Yes, sure.
All right. Let me know if you can see my screen.
We can.
All right, thanks. Hi, everyone. I am Bianca Peterson. I am a data scientist for Fathom Data, and I would like to share some of the client work that we have done. All right, so I'm going to jump straight into that. So we offer end-to-end data science services. We can help with workflows and infrastructure, and you might see some of the topics mentioned on the slide might be of interest to you, like web scraping, building apps, automated reporting. So we offer the end-to-end solution. So wherever you are at the moment, we can meet you there and help you from there. So one of our clients is Denniston Data, and they focus on serving the needs of healthcare payers to help them research and identify the best doctors and manage the medical provider network. So you might be familiar with this term, the transparency in coverage rule, and this requires health plan price transparency to help consumers know the cost of a covered item or service before they receive care. So the challenge with this is that the price data are in big and complex JSON files, which are unstructured and difficult to convert into relational format or into a flat format. And additionally, it's very time consuming and costly to process and report the prices in a digestible form and make it accessible to consumers. So for Denniston Data, one of our clients, we built a pipeline to parse the complex and big JSON files and ingest the data into a PostgreSQL database. And from this data, they were able to develop a pricing guide with the distribution of prices via percentiles. And they also make use of the data for generating ad hoc queries and reports. One of our other clients are Qualia Bio, and they provide insightful political economics and regulatory support for the biotech and finance industries. Their aim is to help ensure patients access to innovative and life-saving treatments. So the challenge is that the drug pricing data were in various formats. The average sales price, abbreviated as ASP, data was published by the Council for Medical Schemes, or CMS, as you may know, whereas the wholesale acquisition cost, which we abbreviate as WAC, data was scraped from a proprietary source. So, additional to this challenge, drug manufacturers offer discounts to wholesalers. So in theory, we should calculate the discount by subtracting the average sales price from the wholesale acquisition price. However, the prices were published by different organizations, and prices for various dosages, even for the same drug, were not comparable. So the solution was to normalize the wholesale acquisition price data and get it into the same scale as the average sales price data. And subsequently, we were able to calculate the number of billable units for a particular drug. So it thus takes the dosage into account. So this is the end product, which was a dashboard. On the left, the image on the left shows the prices, and on the right, you can see the concessions or the discounts. So within the dashboard, the user can apply filters and see the descriptive statistics on the right, as well as the figure in the middle. One of our new clients is Ripple, and they aim to provide a holistic health platform, including health, physical, and mental services in a single site. So they currently make use of a manual process to provide services to their clients, but this doesn't scale well. So we will be building back-end functionality for them so that they can build an app in the end, and we will be constructing a database as well as an API or application programming interface and machine learning models. And we'll make use of SQL Alchemy and Flask for this. Addition to this, we also do training on various topics. The slide can only take this much text while keeping it readable. So we do training on much more than shown on the slide, but you might be interested on any of these topics. And we don't only do training in these topics, but we can also provide technical assistance. Maybe you just need some one-on-one consultation on this. We can do that for you. So our team is diverse and we are distributed across South Africa, and we can work with you wherever you are. So feel free to look at some of our client feedback linked below, and you can contact us at info@fathomdata.dev. Thanks, everyone.
Thank you, Bianca. So the floor is open now for questions. We have about 3 to 4 minutes for questions, comments.
All right.
Please feel free to use the chat or unmute yourself.
Let me just see if I can hit the chat.
Hello, can you hear me?
Yes, I can.
Oh, that's nice. I can see that you have various kind of data tools that you are using to clean, to analyze data, the likes of Python, R, SQL. So if one would like to get some training basically on those tools, which platforms or what kind of online training do you provide, or do you offer such, or just a consultancy as such? If I need to build some skills basically on those items that you are providing service on, what should I do?
Well, you can contact us at that email address shown there on the slide, currently on the screen. And yes, we do online training. We can also do in-person training, depending on what's the best, where you are. As I said, our team is distributed across South Africa, and we are more than one person that's doing the training, right? So all of us have a lot of experience in different fields. So yeah, we have capacity to teach any of these tools. So depending on what you want training in, we can customize a training package for you, and we can decide whether you'd like short training sessions spread over several weeks, or maybe you'd like 2 or 3 full days training. So feel free to contact us with your needs, and we can talk about that.
Thank you so much.
No problem.
Bianca, there's a question in the chat. It says, do you have a preference for larger projects, or do you also take on small projects? Example, development of a shiny dashboard. What happens with maintenance?
Yes, so we do big projects that have run over several months or several years with bigger clients, but we also take on shorter or smaller projects, no problem at all. Sometimes it's just like a 4-hour or 6-hour job to help you with something. We can absolutely do that. So any consulting work that you'd like to have done, please feel free to contact us, and we can set up a meeting to see what your needs are.
We'll take this last question and then we'll move on to the next.
Thank you.
We'll move on to the next presenter. Do you have opportunities for young and upcoming data scientists to join your team?
Well, I'm not the boss, but my boss is on the call if he'd like to answer that. Alternatively, you can also use the same email address to reach out. Andrew, do you want to maybe jump in and answer that?
Yes, I'm very happy to answer that. And we are always looking for people to join our team. So if you're keen to get started in data science and you're interested in working in a remote consulting environment, then we'd be very, very happy to speak to you.
Thank you so much, Andrew. Thank you, Bianca.
Thank you so
Oh,
much.
Andre, sorry, before you can go, sorry for interrupting you. Did you say that you can, you'll be happy to provide remote work specifically for data scientists if they are willing to join your team?
Sure.
Let's say, for example, now I'm in England, and then I have some skills in data science, and then I have some credentials on the subject, and then I would like to offer some services to you. Is that something you guys can work together? Yeah.
Sure, absolutely.
Okay.
And
So
as I
will
mentioned,
drop, okay, therefore.
Okay, so I would encourage that just in the interest of time that we perhaps reach out to Andrew and the team in the contacts through the contact they provided. Thank you. Would like to move on to the next presenter, Quantum Health, South Africa, and I would like to call on Alikan Bayura or Bayura. Is Alikan on the Zoom? Okay, if there's no representative here from Quantum Health, South Africa, would move on to Toybeth Systems LLC. Elizabeth Olawi.
Okay, thank you. So let me share my presentation. Let's see. Okay. So can you guys see my screen?
No, not yet.
Sharing. How about now? Can you see it, please?
No, not yet.
Right. Let's do this again. Okay. Can you see it now? I think.
Yes, we can.
All right, thank you. All right, thank you everyone for joining this breakout session, and thank you DSI for having me. So I'm here to present Toybeth Systems to you and what we're doing in trying to enhance data science infrastructure in Africa. So who are we? Toybeth Systems, we're a global technology consulting company, and we're headquartered in Arizona, United States. Then we help businesses, to to transform their digital dreams to digital reality. And we cut across all sectors. So whatever is your project in healthcare, doesn't matter if it's government, manufacturing, mining, all sectors, as long as you have a problem to solve, or you want us to help you solve your digital problem, provide products that can help people and can now also generate data. So we're there. We're ready to take that project, small scale, large scale. So those are our services. We provide analytics and AI technology services, software applications development, business intelligence solutions. We do program project management, IT advisory, IT infrastructure, virtualization, IT training, and coaching. And we're global, so remote projects, doing remote projects is not a problem to us. We have employees across the globe, so we're really virtual. So that's that. The next thing is that let's see. So right now, what are we up to? We are currently, providing and working on products that can provide tools for harnessing and mining data for research. We also in building product that can provide accessibility, quality, and affordable healthcare solutions, in Africa, even globally. So we're currently building a telehealth infrastructure that will not only cater for people or focused on healthcare delivery, but can also facilitate data for mining and research. Because, across Africa, the challenge is actually having, having access to quality healthcare anytime you want it at affordable price. And not only that, even having the data to mine and provide analytics to predict and help combat diseases and all that. So that's giving people the tool to use and helping government, private sectors to actually provide the quality healthcare that the people across Africa, and mostly Africa, need. Because right now, that's the key for Africans. We believe in Toiber system that healthy people forms healthy nation. The other area we're focusing on is to build a system that can connect diagnostic laboratories and with capability to store data in a manner that can facilitate data harvesting, cleansing, and analytics. We're also focusing on innovation labs that can offer data scientists across the globe to operationalize and commercialize their data discoveries. There's so many data discoveries that don't even get to see the daylight when it comes to translating the discovery into products that people can really use. It's good to have, nice data models, predicting data models, all kinds of intelligence models, but if you cannot package it for people to use, then it's just there. So we are providing labs for data scientists to be able to operationalize and commercialize their data discoveries. So and we're able to do this because we have, Toiber system, at least 50 years of IT experience under our belt. With me and the other people in the company, that we have at least 50 years experience, and we've been doing all kinds of analytics solutions, which you see on the next slide. So if you're interested in joining us, or you have a project that you want us to help with, that's my contact right there. You can reach us or check our website, toibersystems.com. My contact is there, direct email is there, the company email is there, and the phone numbers are there. So right, well, finally, before we jump to Q&A, what are we doing right now? What have we done in the past? We are providing meaningful employment opportunities for people globally, even Africa. We have employees spread across Africa doing marvelous things, and we're still open, for more people to join us globally. Some of the smart solutions we've delivered to government, private, and public sectors include a telemedicine solution and at-home test applications for medical providers. We've delivered predictive analytics solutions that has helped government assistance programs in winning people from, your government assistance program to actually being able to stand on their feet, doing good jobs and winning off of the assistance program, thereby saving government lots of $1 million. We've delivered analytics solution for predicting maintenance in the mines, helping the mines, to know when to service their trucks, preventing operational loss, adhering to safety practices across global mine locations. We've done franchise intelligence, competitive intelligence, social intelligence for Fortune 500 animation company that helps them to understand the behavior of the consumers and help them to target when to actually release movie and who and where to release the movies to in order to gain their to have their ROI quickly. So we've done all this work, and we will continue, to get work and even provide products that can generate data for data scientists to actually mine and do marvelous things and help people across the globe. So thank you. If you're interested to join us or you have a project, that's my contact right there. And you can also check us out on toybersystems.com. And this presentation will also be available at the link provided by DSI. Thank you.
Thank you so much, Elizabeth. I would like to, we have about 2 minutes for questions. If anybody has any question, please feel free, use the chat or unmute yourself.
Yes. Thank you very much, Elizabeth, and thank you for the organizer. My name is Henry Tonan. I lead the unit in data management and modeling in geoinformation within a research institution. And as I was listening to you, one of your first slides, you mentioned that you are harnessing data science for research. I don't know exactly, because currently I'm trying to do something. I'm trying to build an AI system that can scan through a PDF publication and somehow extract data from there. And it's something we have been working on for some time. I don't know if you would be interested in something like that, and how can we get linked to you to see how to partner in such a project?
Thank you, Henry. That's great. I would love to, collaborate with your company or your organization, because that sounds interesting. We have you're doing a fantastic job, because we have lots of things, lots of data sitting in documents, PDF, some are even in Word documents, right? So that's a smart solution to have AI to help people. So, I mean, when you get all this data that people put in document, schools, that will help a lot of institutions, a lot of companies. So I will be really glad to collaborate with you to see how we can develop such AI and get that product out, because it's about product that can help people and can transform people to that digital phase that we're in right now. And that's why, and it's supposed to create more jobs. So people should not be afraid that AI is taking their jobs away. It's actually creating more jobs. And also thanks to all the data scientists, because that's where you guys play a lot of roles. So yes, Henry, we can connect, after this call, and then we'll go from there.
Thank you very much. I will surely be in touch, and we will see how to move this idea forward. Thank you.
Thanks.
Okay, thank you so much. If you do have any follow-up questions or any comments, please reach out to Elizabeth at the contact information she provided. So Elizabeth, thank you so
Gibbs.
much. We would move
Thank you,
on
Gibbs.
to Ali, I believe, from Quantum Health South Africa. She's on now. Ali, you can take it away. Thanks.
Hello, good afternoon, everyone. Apologies, I'm having a bit of internet issues. So those who are familiar with South Africa, load shedding is quite a problem with internet connection. So unfortunately, I cannot share my slides, but I hope everyone can hear me.
Yes, very well.
Yes, we can hear you.
Perfect. So I'll hopefully talk through my slides, and if there's any questions, happy to answer later on. So my name is Ali Vera. I'm the head of Quantium Health in South Africa, and I'll talk a bit about the work that we do and give some examples of the projects that we have done. So Quantium is a data science consultancy firm. It's global. We have presence in a number of markets, including South Africa, and we have over close to 1,000 data scientists all around the world, working on a number of different areas, health being one of them, but also banking and retail. And we hire a diverse range of people, those with data science, of course, core training in data science, but also people with backgrounds in strategy consulting, software engineering, and industry expertise, to bring together sort of a more well-rounded team to consult for our clients. We work in two main areas. So we do kind of core data science work, which is helping our clients translate raw data into actionable insights. So this includes things like data cleansing, curation, building data ecosystems, and doing applied analytics, but also kind of build more advanced machine learning and artificial intelligence products on top of existing data sets. So we kind of work both at the early stage of data, but also at the kind of cutting edge of data. So I'll talk about some of the areas that we work in. In particular, there are a couple of areas we specialize in. I'll talk about mainly the health areas, which I think is of interest to everyone here. The first one is we do sort of fundamental data engineering work, where we build analytics platforms on top of existing data sets. So, things like DHIS or hospital EMR systems, large research data sets, to help our clients extract insights much quicker. We also build machine learning and advanced analytics products. So, for example, things like predictive models for supply chain forecasting, optimization, predicting onset of disease. And I'll talk about a few examples right now, using geoanalytics. We also specialize in doing value-based healthcare. So that's one of kind of our core areas of expertise, which is how do you set up a healthcare system in a way that you can provide value-based healthcare. So, this would include things like cost effectiveness models, doing real-world outcome studies, and really tying health outcomes to the value that it provides. That's one of our core areas of expertise. And then we also do a lot of market access and commercial support for our clients in pharma, medtech in South Africa. So this would be things like HTA analysis and understanding market positioning. So that's kind of the 4 or 5 main areas that we work in. I'll give a few examples of the projects that we have done. So the first project that I'll talk about is one that we have done in Ethiopia through a Bill and Melinda Gates Foundation funded project, where we built a microgeographic population model on which we built then optimization models to identify where the Ministry of Health can put vaccine sites for COVID to optimize their reach, and in particular identifying areas that have low reach or low uptake, really at a micro level. So kind of, a few tens or 3 or 4 square kilometer granularity, and helping them identify site locations to augment the vaccination program. We did this in a couple of regions in Ethiopia, and worked together with Ethiopian local agencies, where we trained them and handed over our models that we had built. So that's one example of the project that we have done. And another one, which is probably what a lot of people know us in the market for, is we are the exclusive data partner for Discovery Health, which is South Africa's largest private medical insurance. So we use Discovery Health data to really provide insights to our clients around patient journeys for different diseases, as well as value kind of outcomes-based projects to understand the impact of their products or drugs versus others in the market. So really, kind of working with large data sets. I think it's more than 3.5 million people data that we work with, all be identified and compliant with the strictest privacy laws, but still really using that to provide insights to our clients around what's happening in the market. So I'll just pause there, and apologies again for not being able to share my slides.
Ali, I had your slides up. I pulled it from the file.
Oh, thank you.
Provided.
Thank you. Yeah. Good. That's all I had. Thank you. Happy to take any questions.
Okay, does anybody have any questions for Ali?
Yes. Darlington?
Yes, I can hear you.
Yes, Ali, thank you very much. I think your presentation is great. I just want to know if you can also do predictive model for value chain analysis.
Sure. Can you tell me a bit more about value chain analysis? What do you mean by that?
For example, no. So for example, if you discover crude oil on the ground, you need to be able to analyze the crude oil value from the ground to the point of sales.
Yeah, I mean, we do value-based healthcare, so kind of value analysis in healthcare, which is identifying what actually matters to the patients. So not really kind of the value that you're talking about, but certainly we do value-based analysis in healthcare. So,
okay, I think if you know about the value-based, I'm sure you can. If you familiarize yourself with all the elements, which is the input at each point or each stage of the production, then you can do a model to predict the value at the end.
Yeah, perhaps something to think about in the future.
Okay, thank you.
Thank you.
Okay, Ali, there's a question in the chat, or is it a comment? Yeah, it says, thank you for the presentation. As an international entity, what are some mechanisms you use to meet regulatory compliance in the respective client countries as it pertains to their sectors and the data products or services?
Yeah, I think that's a great question. I mean, we are very, very cognizant about data privacy, and we work with a number of large organizations around the world who take data privacy and security very, very seriously. So we first wouldn't work in a country where we wouldn't be comfortable with complying with the data privacy. So I think that's usually a first checklist for us. But to take an example of South Africa, where we have this partnership with Discovery Health, we've applied the strictest data security on our platforms, and also, kind of, for example, de-identify all the data. So even the data that we receive has no personal identifier, so there's no risk of, being able to identify any patient or anything like that. So we apply all these rules to make sure that the data we receive is safe and secure, and also that we are able to comply with the safety laws. So we wouldn't enter a country if we wouldn't be comfortable with that.
Okay. Any more questions or comments?
Gift, I think the question you just asked from the chat was directed at Elizabeth.
Oh,
It was from the previous presenter, yeah.
okay.
Yes.
Bianca, you said it was directed at who?
It was directed at Elizabeth. It said, Elizabeth, thank you for your presentation. And the question was asked.
Oh, gotcha. Okay. Thank you. Thank you for
Yeah.
pointing that out.
No problem.
If you also want to respond?
Oh, sorry. Sorry, I didn't get the question. I'm so sorry.
Okay.
Kind of had,
Question. Oh, yes, it did say Elizabeth. It says, as an international entity, what are some mechanisms you use to meet regulatory compliance in respective clients' countries as it pertains to their sectors and the data products and services?
Okay, so yeah, different countries have different laws. So before we roll out any product to any country, especially in the area of healthcare, first of all, we make sure that the HIPAA policy or laws are fully complied to. In compliance with HIPAA, we also go through the GDPR compliance. And remember, this is a product. So depending on the pieces and the parts of the product, for example, in a telemedicine platform, you want to make sure that maybe the video conferencing also complies to the HIPAA, the GDPR, or the other country laws. That's one thing. And then as far as the data is concerned, I mean, there's a general required data policies that must be adhered to, regardless of the country, right? Encryption at rest of data, encryption in motion of data. So we make sure that we comply to all those. And a product that will not work for a country, then we just don't market it there. So that's how we're handling that. Does that answer your question, please?
I hope Nicolette will respond soon.
Okay, thank you.
Thank you, Elizabeth. And anything else, Ali, you want to add? Any final words? And then I'll ask Elizabeth and I'll ask Bianca the same.
Yeah, I think that just thank you for the opportunity to allow us to present, and happy to discuss with any potential partnerships around how better to use data in improving public health on the continent. So yeah, thank you.
Okay, I'd like to say that you can find Ali's information on the DSI website. So you can check it out and contact him. Elizabeth, any final words?
Yes. So I want to thank everyone for listening to us on this in this room. And if you have any projects, we don't only play in the data science area. You saw all the services that we do. Please feel free to reach out to me directly. I've put my contact in the chat. It's also on the DSI site. And you can check us out on our website. You can contact us through our website as well. And I will be glad to work with you. So thank you, everyone.
Okay, Elizabeth, there's a question in the chat for you. It says, can you talk more about the telemedicine your company is building?
Oh, okay. Yeah. So the telemedicine we're building, for Africa, he said the challenge is actually to have that quick access to qualified doctors. So it's a global telemedicine. It will afford Africans to be able to not only see doctors in their country, but they can actually get second opinion, third opinion, across the globe. And it has a lot of features in it, whereby, for example, for the diasporans, can help their families back home with gift cards, right? People in Africa have families across the country, across the globe, and they always ask, okay, money if they're sick. Well, when you send money to Africa, they get the money and some don't use it for healthcare. When we buy gift card on that platform, they will have to see a doctor there. So there's so many ways that that telemedicine can bring both the patient and the providers together, and not only primary physician, therapists, psychologists, all aspects of the healthcare, and not just for video conferencing. They can do text messages, they can do just phone calls, and it can also push medication to the pharmacy, for the pharmacy of their choice, provide pharmacy in their area so that they are actually getting authentic medications and not all the fake products or medication that is across the continent. So that's the telemedicine that we're building. And it's going to generate a lot of data, because inside that telemedicine, we have electronic health record built inside it. So that, I mean, that's something I know that's good news for data scientists, right? Because then we can mine that data, institution can also use it for research. So you can do all kinds of predictive analytics to help at the continent. So that's the kind of telemedicine that we're building. Okay. Does that answer your question, please?
It touched on the other question that he asked. I think you just answered, you conquered the two in there. Thank you so much, Elizabeth. Bianca, any final words you'd like to share?
Thank you so much. Yeah, also thank you from my side for everybody that joined and listened to the talk. I just wanted to say, I don't think I mentioned this, but we can help you from scratch. Like if you are at the stage where you need to design survey questions, we can even help with that. Everything from your project setup all the way to a model or an app or a shiny dashboard, whatever your needs are, wherever you are at. We meet you there, we see where we can improve your current or existing workflow, and we can propose alternative solutions or help you just from there to make it even better. So yeah, whatever your needs are, feel free to contact us. I've also popped details in the chat, and it's linked on the presentation. Thank you so much.
Thank you. I believe Nicolette has a last question in the chat. Nicolette, if it's directed at Elizabeth, if we don't have enough time, you can reach out to her directly, but I think she can attempt to answer this. Elizabeth, if you're available to take this question, is any challenges with pricing structures and the respective insurance and social service provisions? Also, any challenges with price and fee transparency from the providers? So,
yes. So as far as pricing is concerned, I mean, people with health plans, across the Africa or across the globe, people have health plans. Some don't. People with health plans can actually go through their health plans on the telemedicine platform by just paying with their health plans, and the providers will work with the health insurance companies, to get paid. People without health plans, the providers will set the price, and it is going to be something affordable to the people, not that, because first of all, the telemedicine is taking away the office visits costs, right? So